Good morning, Facebook. Good morning, family and friends. Wait till a few people get on here. I'm sure most of y'all at work. This live is going to be, before I even start my live though, I got to send a shout out to my team, New Orleans Saints, where my Louisiana folks at. Y'all see who I got on and representing? Breeze. Y'all see it? I slept in my jersey. That's why I look like I look. Breeze. Bam. Okay, so I'm going to be discussing the courteous nurse versus the non-courteous nurse today on my live. Hey, Kim. Hey, Mark. 4 talking points that are up for discussion is reordering medication, cleanliness after your shift has ended, restocking your carts, and verification of orders. Okay. Like I said before, and I guess this is kind of like my little disclaimer at the beginning of my videos. What I say is not gold. It's not even platinum. What I say is purely my opinion, where I've worked in certain situations, certain nursing homes, certain hospitals, and I just see certain things, and I just feel a need to have to talk about it. But what I'm truly saying is, I didn't get my PhD and a doctorate and all of that yet. This is real life experiences. So anyway, 4 talking points today that's up for discussion. I see some people coming on. Hey, Keish. Hey, Diana. Hey, Chantel. Reordering meds and narcotics, cleanliness after your shift has ended, restocking your carts, and verification of orders. Okay. This is, like I said, this is how I feel. If you're a part-time nurse or a full-time nurse that's, on the same cart every day, and we know these types of nurses, most of them don't want to go to another cart, even if that we got somebody that done orientated on their cart that's there, and another nurse is called in for that day. They will not go to that nurse's cart. They'll put that new nurse on the cart that's unfamiliar to them. That's those kind of nurses. So if you are that kind of nurse, you work part-time, you work full-time on the same cart every day. I feel like you're responsible for that cart. That is your baby while you at work. So how you treat your baby at home? I just want to ask that question, how you treat your children. Your cart is your child while you at work. And if you dog your children out, obviously you dog your cart out. I done seen it happen. We all have. So you're responsible for that cart. So take some responsibility and accountability, which means if you have 2 scheduled narcotics left on your card, and you know that this patient is the type of patient that complains of pain every 4 hours, especially if it's a scheduled narcotic, you're gonna need it, and the weekend is approaching, and your failure to do so lets down your whole team, mainly the resident. It is a reason a patient is receiving a narcotic pain med. They probably have chronic pain, If a patient has chronic pain, first of all, as a nurse, we know that we cannot diagnose the patient's pain. We all know there's a major opioid crisis in America today. We know that sometimes we feel like legal drug dealers on our shift. But at the end of the day, we as nurses cannot diagnose pain. And what I mean by that is what we've all been always taught was pain is what the patient says existing at the time and at the location that the patient says that it is existing. Something along them lines. But basically, it's not for us to say that they're in pain or they're not. So like I said, we don't prescribe medications. We don't diagnose. That's the doctor's job. So if you are that type of nurse that doesn't give your patient their scheduled pain meds or their PRN pain meds when you know they're in pain, you're not doing your job. If you assess the pain and they telling you they're in pain, give it to them. If they're asking for it every 4 hours, get it scheduled. If you don't feel like them running to their room every 4 hours, anticipate the need. Like I said, some people have chronic conditions. back pain, fibromyalgia, sickle cell, lupus, just different stuff that causes different pain. I have a high tolerance for pain, but my tolerance for pain is not like other people. You know, I can be experiencing a pain of 10, but in all actuality, I still take an ibuprofen and keep it moving, you know, and I mask my pain. Everybody is not capable of doing that. So with that being said, you know, learn your patients, assess them, and medicate. When you have medications like Vicodin, your Percocets, your Lunestas, your Ambiens, you know they're running out of sleep meds. Take care of that. Because you know what? These part-time nurses and these full-time nurses, the majority of them do their job. But it's some part-time and full-time nurses that feel as though everybody else is supposed to stock that cart. They designate one main person to stock that cart. No, hunty, it's a team effort. It's a team effort. And when working as a team, hey Tish, how you doing, boo? And happy belated birthday. You looking good. It's a team effort. I'm just saying, you know, y'all worry about stuff like the Remeron and the melatonin. That's over the counter. Melatonin is over the counter. Remeron is not a narcotic. It can be used as a dual action med for sleep and as well as an appetite stimulant, but it's a non-narcotic med. You worry about your Lunestas and your Ambiens and your Vicodins and your Percocets and your Dilaudid. I don't even think they give Dilaudid as much anymore, but your Schedule 4 narcotics, that's what's important. How many nurses out there work full-time at a nursing home or work full-time at a place where narcotics must be reordered or you have to receive a hard script for them? Why are you management staff allowing this to go on? First of all, if you're a good manager, you know what's on your cart. You know, if you're a good manager, you interview your patients, and certain patients, you know who to interview. You know who's going to tell you the truth. You know who's going to come with a whole bunch of mess. But interview your patients to check on these nurses. It doesn't have to always be staff snitching on staff, because I don't call it snitching. Sometimes, you know when a nurse is coming at you sideways about other nurses or other CNAs. But when a patient is verbally telling you, hey, I'm not receiving my pain medicine when such and such works. You know, a lot of the nurses are real petty. I've seen cases where they withhold a patient's narcotics because they don't like the CNAs and they trying to have the CNAs run all night. That's petty. Don't do that. But we do. You know, people that's receiving anxiety meds. Oh my God, Xanax, Ativan. For these 3 to 11 nurses, that's like Bible meds, because these people need their antipsychotics. We all know that during the 3 to 11 shift, that's the shift where typically sundowning occurs with these Alzheimer's patients. If you don't know the disease of Alzheimer's and what we experience as healthcare workers, as family members, y'all need to read up on that. Alzheimer's is a serious illness that affects a lot of people, and really the majority of our geriatric population in these buildings. When I say sundowning occurs during the 3 to 11 shift, 3 to 11 shift is the worst shift possible to me in a nursing home. You got your behaviors that's being exhibited. Like whatever happens on the outside in the world, you see people getting, you know, it's not as bad as like people getting killed in a nursing home. It happens, but that's rare. But as far as being a macronism of what happens on the outside, such as the fights that occur, because these people, they get confused after hours. And if they were fighters in the day, back in the day when they was younger, you know, 9 times out of 10 they come to the nursing home, you don't know what's going on in their mind on that day. Every day is individual for that person with Alzheimer's or dementia. Every day is individual for that patient. So you don't know. So if you're the type of nurse that knows that this patient may exhibit behaviors, you know what? They gonna need to be one of your first people to be medicated. If there's a problem where you're unable to reorder your meds, let somebody know. Let your management staff know, because you know what that does, nurses? That covers us. And document it yourself. You know, the med wasn't in. Is a way you do it to where it doesn't flag for state, and that's a whole nother topic on one day. And I got a compliance. I have a compliance video that I'm gonna do. It's probably gonna be done after this one tomorrow. Cleaning of your unit after your shift. And this goes for CNAs and nurses. Y'all dirty CNAs and y'all dirty nurses, because it's dirty CNAs and it's dirty nurses out there. Okay? Anybody work with me, y'all already know I'm the wipe me down nurse. I done been called that so many times. I'm the wipe me down nurse. I'm getting the purple top pads, the Clorox pads. I'm getting whatever, because people don't understand that these surfaces that we're constantly coming in contact with, a patient's bedside tables, the phone at the nurse's station, a desk at the nurse's station, these chair arms, doorknobs. I mean, everybody don't come out the bathroom and wash their hands. You understand? Everybody doesn't wash their hands after they shift. Hey, Sonia. Hey, Cuzzo. Nisha. Shout out. You see what jersey I got on, huh? New Orleans Saints. Y'all, excuse me if I'm, you know, on one today, but you know, that's how I feel about my team. I've been trying not to. I hope Angela Ricks don't come up here with that Cowboys mess. So cleaning of your unit after your shift. Responsibility of you as a nurse is to clean up after yourself as a nurse, and CNAs, because what others won't say is, you know, dang, she don't never clean up after. She always got trash left over. She always got her water, you know, and for that to not be a topic of discussion, a petty topic of discussion with the rest of your coworkers, clean up your mess. I mean, it's courteosity. You know, it's a courteous thing for you to prepare your shift for the next shift coming on. Okay. Restock your carts. Ain't nothing more terrible than coming on to a, number one, disorganized cart and a very unclean cart. Disorganized means, as a nurse, if you are a nurse on these nursing units, you know, when we come to our medication cart, it's certain things that have to be in a certain position on your cart in order for you to be in compliance with the state. For example, all insulins must be on your cart, dated, and it must be within a 28-day time frame, as well as eye drops, inhalations, and your narcotics, and your pills and your bubble pack pills. You know, that's what a lot of people fail to do. And like I said, I'm going to get into that on my compliance video. But a lot of people fail to reorder their meds. Restock and reorder your meds and clean your carts. When these supplements like Prostat, MedPass spills on your cart, they get hard. You know, you have to understand that it has to be clean. You can get tagged for that. A lot of people don't know that. A few years ago, state came in the building that I was working in, and they tagged us over some petty stuff. But we was like, how did we get tagged for an unclean pill crusher machine? We don't think about the types of bacteria that are lying around us, like I said, on these surfaces. One of the most important things that I feel as a nurse that we need more follow-up on is the verification of orders. I've seen orders that have went from needing to be verified the day of admission, and 5 or 6 days later, they're not verified. First of all, you got poor management because they're not checking admission charts. Second of all, where's the follow-up from the nurse and the manager? Because if the manager couldn't verify that order that morning, why isn't it going through all 3 shifts? Communication, people. Hey, Miss Pie. Hey, Miss Goodman. Hey, T. Verifying orders are important. It should be made one of your first priorities, especially when it's a medication like Coumadin. Coumadin, for those of us who don't know, Coumadin is a drug that is given to people, like, say, after surgery, something as simple as surgery. It decreases the risk of blood clots. So it's considered an anticoagulant, which is basically, in layman's terms, a blood thinning medication. So we as nurses in these long-term care facilities, if we have a patient that's on Coumadin, generally what will occur is Coumadin, PTINRs are the lab drawn for Coumadin administration and dose changes. Okay, so say you have a patient just coming into the nursing home, got admitted. He's on Coumadin 2 milligrams. He's admitted that Monday in the nursing home. His PTINR lab is drawn, so the lab is drawn like 4 something in the morning. Well, say he came Friday. His lab is drawn Monday morning, 4 something in the morning. As a 7-3 nurse, understand me when I say people, as a 7-3 nurse, because just like I said, 3 to 11 is about to start dealing with their behaviors. But as a 7-3 nurse, it should be your sole responsibility to verify Coumadin orders. Point blank. That's my opinion. Like I said my disclaimer before I started. A lot of 7-3 nurses might feel some kind of way. I don't care. But it's just being courteous to me. You're there 7-3. You get your orders drawn that morning. Your lab typically has those Coumadin labs done by at least 11, 12 o'clock noon. You got 3 hours left of your shift. Why you couldn't call your doctor and say such and such, or fax them over? I need orders on this. And if you're at a nursing home where you communicate with your doctor's office, these doctor's office nurses are very good. Some of them, they'll have that lab to you back before 1:30. It's back before 1:30. So then when the medication is due, because generally it's due at 6 p.m. during the 3 to 11 shift, have that dose ordered already. And have that in report when you're giving her report. Hey, Mr. Smith is on Coumadin. His dose changed today due to his lab. It went up to 2.5 milligrams. He already has 2 milligrams in his drawer. You might have to go to the stat box and get a 1 milligram and break it in half. Simple explanation. It saves people's lives. Communication saves lives. Another thing, utilize these stat boxes, people. My biggest pet peeve as a nurse, okay, this is how it starts. I'm your typical patient. This is how it starts. That needs antibiotics, but everybody ignoring it because they acting like, oh, that's just a behavior. First of all, if Mrs. Smith never has behaviors, you've never seen this lady have behaviors, but you go in her room that morning. This is the first day. This is that Monday. You go in the room after the weekend because, you didn't have some PRN part-time weekend staff going to school on the weekend. So, and some of them are good nurses and CNAs, but for the most part, you had some staff that wasn't really as efficient is what I'm going to say, to be positive. You had some staff that wasn't as efficient on the weekend. So come Monday, and you left Miss Smith Friday, come Monday, her lips are dry, her tear ducts are dry. She is not drinking as much as she would generally. She's combative whenever you changing her. Okay. You notice in her diaper, her urine is like a brown. It's normally a bright yellow. Okay. You need to communicate with that nurse as a CNA and tell her that, so she can get an order for a UACNS. So we get the order back for the UACNS, and it comes across as this patient has bacteria in their urine and they have a UTI, urinary tract infection. Well, now 2 days later, after they get the culture and sensitivity, the doctor puts her on something prior to getting the culture and sensitivity back, but it's the wrong antibiotic. People, this happens often. This happens often in a nursing home. So when this happens in a nursing home, the job of the nurse, especially these full-time and part-time nurses, the job of you as a nurse is to call that doctor or the doctor's office nurse and let them know, hey, Miss Smith was placed on Cipro 500 milligrams twice a day for 10 days, but she's resistant on her, and resistance to nurses means that particular antibiotic is not working for that patient. So then what you do is you get on the phone, like I said, call the nurse, you read to her which ones are sensitive to that patient, which means which antibiotics would be that she could be placed on will actually work and do the job and kill that bug that she has. So it's almost 3 o'clock. You've got the order, but pharmacy don't deliver till later. They on Bactrim DS, 1 pill twice a day for 3 days. Check your stat box. Because we as nurses, that's called a delay in treatment. We as nurses, hey Lydia, oh my gosh, she's looking at my live. I would bring you in, but I'm not. I'm just not doing it. I'm not ready for it yet. So we as nurses, we know that that person needs to be placed on an antibiotic that will work for them. Like I said, so it's coming through the 11 shift. Communicate with that nurse that, hey, those antibiotics aren't in just yet, but you can check the stat box because I'm pretty sure Bactrim comes in the stat box. Courteous nursing. Okay. Ain't too much been on the CNAs, but since Lydia is up here, I'm going to do a shout out to them. Oh, by the way, Lydia, shout out to the Saints. I'm just saying. Courteous CNAs. Before the end of your shift, please pass ice. Number one, like I said, I went into the whole sundown and Alzheimer's disease process. What do these people mainly need? Hydration. They need hydration. Fill your ice at the end of your shift. You wouldn't want your grandmother or your mother or your father to be in one of these facilities and you don't have somebody that's properly hydrating them. Hydration to me is more important than food. I'll say it again. Hydration to me is more important than food. Especially with the elderly. They have a higher risk of becoming dehydrated before us. You know. Thank you, Ms. Costello. If you are a CNA, hydrate your patients. Make sure you got ice and water. I'm going to say that again, ice and water. Because, you know, some of y'all get slick and just put ice. So where the water melts, y'all do the ice at 2 o'clock, the water melts, and it look like they got a full thing of water. No, they got about this much water and this much ice. Don't be petty. Ice and water. It still looks like y'all giving them ice during the end of your shift. Another thing that really ticks me off, when CNAs leave trash full in the rooms, like empty your trash bags. And I know in most of these facilities, housekeeping feel like them little thin bags is worth keeping around. They're not. But, you know, if you're a smart CNA, you would quadruple or put like 6 or 7 bags in one trash can. So whenever you're leaving your shift, you're just pulling bags. Common sense. I'm just saying. Another thing some CNAs will do. If you know that a particular patient goes to sleep early every night, but it's your job to get her up in the morning on 7 to 3 and you put her back before 3 to 11 shift come in, why are you putting her back in bed with her clothes on? All of her clothes on? So now, whenever I get her on my 3 to 11 shift, all her little pants that she had worn throughout the day, everything is soaking wet, including her top sheet, her top blanket, and she done urinated throughout the bed. It's crazy. I'm not adding you, Lydia. I'm not ready for that. Stop pressuring me. Another thing that CNAs commonly do that ticks me off also is they know certain patients are supposed to be down before the next shift starts and they keep them up. Now, I'm gonna just put y'all on blast, y'all types of CNAs that do this. I'm gonna just put y'all on blast, right? I need y'all to understand that everybody knows that these patients are supposed to go to bed at a certain time. And you think that they don't see you leaving them up every day, but they do. They do. But you're the same CNA when a family comes in, you talking their ear off about absolutely nothing. Like you're doing so much for their family member. You know, y'all need to stop with that faking. You know, a lot of y'all need to stop with that faking. Okay, I'm going to end this session with adding Lydia. I don't even know how to do it. Man, okay. This is a big mistake, y'all. But she is a CNA. She's a great CNA. And I do want her opinion on this. So let me just go ahead and see. Are you even coming up? I don't see that you're coming up. I'm trying to. I don't know. What you mean? I'm just learning how to do my live. I don't even know what you're talking about. But anyway, so it must be meant for her not to come up, y'all. Because Lord knows, I don't even know what she would get into talking about. But like I said, this video was purely on how to be a courteous nurse and CNA. I appreciate all the love that y'all give me on these videos, y'all. Hey, Keisha. I appreciate all the love y'all give me on these videos, but a lot of these topics that need to be brought up, which is the main reason why I do these videos, a lot of these topics need to be brought up, and a lot of people in these facilities ignore it. It's like the elephant in the room. Oh man, go ahead, Lydia. Go ahead. Be brought up. Hey, Keish, you want me to add you too? These are CNAs, y'all, that I've worked with for years, and they are excellent CNAs. Oh my God. Okay. So I see what this is gonna be. I see what this is about. Hey, Boo. So we're discussing courteous nurses and non-courteous CNAs. Some of the things I touched base on as far as CNAs go is the fact that hey, Sanika, is the fact that the things that we don't like to see you leave behind, basically, when you're not courteous, is like trash in your trash bags at the end of your shift, not filling your ice, leaving patients up that you know is supposed to be down before your shift ends. Do you want to comment on anything else that you can think of? I think I hit most of the points.
Yeah, you hit a lot of points, but all CNAs are not like that. I just like to put that out there, that we're not all like that. There is some.
That's my disclaimer. If you watch my videos, that's my disclaimer. Y'all don't understand.
You were making it pretty direct, talking about you, and I just like to put that out there. I'm not one of them.
Oh my God!
But if you feel I
just want y'all to know, if y'all feel some kind of way.
You are a great nurse, so you get to see a lot of things that bad nurses do, just like as well as I see a lot of things that some CNAs that have technical difficulties do. It doesn't technically make them bad. We all have a life before and after. You know, we get to work just like you do, and we seen it from both hands. You being my charge and the LPN, and me being the CNA, being the person that have to take orders. So, you know, a lot of people, you know, we have a lot of different CNAs, a lot of different attitudes.
Look, Keisha up here talking about. I already know that all CNAs are not like that. I already know all CNAs are not like that. That's one of my disclaimers I put out there. And me being a CNA before I was a nurse, is a difference to me. I feel different about that. So no, it's not everybody. Just like every nurse is not a bad nurse, every CNA is not a bad CNA. So I want to put that out there. But for you non-courteous CNAs, I just want y'all to know that I'm doing a compliance video on tomorrow regarding making your facility state ready before your state window is open. And I'm going to touch on a lot of things, like practicing out of your scope, the things that you do that you're not supposed to do, that you feel like you helping your nurse out, like changing colostomy bags. That ain't your job. Even though I made you do a lot of stuff, Lydia, we're not going to talk about that on camera.
We're not going to talk about that on camera because I no longer work at the facilities that you had me doing a whole bunch of stuff at while you're talking about compliance. I'm going to say she is very non-compliant. She's a great in front of state. She is uncompliant all the time. 25-8.
She knows not compliant. I'm very compliant.
Put it in my...
But
I like to just... put on my
Oh, so you got everything red skin. Keisha said for you to get offline with that dead skin stuff on. Hey, Miss Maddie. Hey, Hermione. They watching us, Lydia.
Hey.
So talk about let these nurses know what types of things CNAs think nurses do that are not courteous to them. For example, like tube feeding. Let's speak on it.
Oh, okay. I think it's non-courteous when they come in to do their flushes and don't recheck them and don't be they not, most of it is because the nurses is not knowledgeable. Either they new to it or they just, sometimes they just being spiteful to you. But I thank God for uh, supervisors over them that actually pay attention to the stuff that we
Right.
say when they nurses is doing something wrong. Like we know, being a CNA for 15 years, I know a lot of stuff that a lot of new nurses don't know, and some of the nurses that are stuck in their old ways because they've been a nurse like forever, my whole life, don't know, how to go along with change. A lot of nurses don't
Right.
go along with change. And
Okay, what about those
after we
CNAs
doing
that
a
don't
whole
go along
bed
with change?
change and changing somebody, you really don't want to come back to those tube feeding. But I'm a proactive person, so I pretty much clean it up and get it done and get it out the way.
No,
But
I'm gonna tell you what you
definitely gonna
do.
let the
I'm gonna tell
nurses
you what you
know.
do.
I'm gonna let them
I'm gonna
know,
exactly.
and I'm supposed to.
And you're gonna pad the patient with 15 towels with a tube feed and
And
almost
I
coming up
might,
out. It won't happen again because you petty.
yeah.
Shout out to the petty CNAs, y'all too.
Could just, I could just take the rest of the tube feed and pour it on top of their cart while they're not watching.
Yeah, that's true.
I could be petty.
You at work, don't hunty.
Yeah.
But look, I'm about to end my live. This is the end of this live. I'm glad you can join me on my very first one. Did you enjoy it? Positive feedback, baby.
Yes. Hey, everyone. Peace out.
You did.
Redskins.
Okay. So
Redskins Nation.
So I just want y'all to know. I just want y'all to know. I'm bringing more than one person on. So if you want to invite yourself, that's fine. It's not going to be Lydia Lee all the time. Trust me. It's going to be too much. 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 So Sanika, Keisha, Ish, anybody that I didn't mention, Miss Stella, whoever want to jump on the live, and I have questions for CNAs. I mean, I'm interested in what y'all want to know because we need to get this stuff out here, y'all. This positive reinforcement in a nursing environment is not anything negative. We love our jobs. We love our residents, but we're going to make this work together worldwide. If you know better, you do better. I'm going to chop 2 of them up for the Saints, baby. 9-3. 9-3.